Welcome to the Big Biz Show, featuring insight, analysis, and a lot of stuff that's none of your business.
Hold on. This is the Big Biz Show. I think it is their business.
Making the markets work for you. Here's the man with the plan, Sully.
We're here at the 2024 Bio International Conference at the San Diego Convention Center, the world's most prominent gathering of industry leaders across all of biotech.
Howie and Devon, once again.
You're watching the Big Biz Show. All right, so we're here to do interviews. Why are we interviewing?
Well, we're here to help showcase some of the most innovative biotech companies on the planet that want to show off a little bit and have agreed to do some interviews just for the Big Biz Show.
Oh, nice. Biotech, like flu shots and stuff?
Yes, good job. That is right. That is technically right.
So we can have my candy now?
No. Only one a day. We're at the theater area where companies are every 15 minutes coming on to do quick showcases with the latest and greatest of what they have to offer. No, there's so many companies that we have over 10 theaters across a 4-day event every 15 minutes. Lots of showcases, lots to see. We're here with Steve Glover of Zyversa. We just wanted to get a little update. Well, he's a frequent guest on the show, and we're here at Bio Conference 2024.
Yeah, Howie.
Great to be with you.
Good to see you again, Howie. Appreciate it. Yeah, Bio, it's a fun conference for all of us. 15,000 of our closest friends.
Right.
I just met with somebody that I've known for 20 years. And we're talking about, development and what we're doing. And, those relationships start at a conference like.
It's the traditional earliest form of viral marketing. So you have the entire industry coming together in one spot to talk to each other, to communicate with each other, and share their biggest breakthroughs of the year. So it really does tend to be where news is made. Devon, we're filming, back to work.
So perfect. Oh my goodness. Howie and Devon strike back. They need their own channel, right, Mary? I mean, as a social media expert, could these guys just go viral?
They need their own channel, yeah.
They just have their own damn show. Like, if they do a show online, they can do like 10 minutes at a time, 11 minutes. There's no set for it, right?
Yeah.
All right, good to see you guys. Look at the bands up there. Of course, Day Trader Trio. Great to have you. Okay, so the Bio Conference in San Diego is where many biopharma companies coming right off of ASCO, which is the American Society of Cancer, I think. It's all the cancer cures, was just 2 days before that. And this is like a speed dating sort of environment where these companies go sit in front of investors.
Oh.
And keep in mind, many of them are publicly traded. And it's a long soak when you put money into a biotech firm. Because much like a venture deal, if you put money into a venture capital deal, say the person made Yeti, okay? Yeti was a privately held company. In fact, we looked at that deal and we were offered a piece of that and actually took a piece in our venture fund many, many years ago. But they were out there doing what's called an A round, and they were going out there, and you realize this is gonna be a 7-year deal before they either go public or get acquired, or private equity comes in and does some sort of a partial exit, okay? Once it's public, you've kind of had your exit strategy, except unless you're in a biotech firm. And a biotech firm is, well, we are publicly traded, but there are criteria-specific investors to Biopharma that understand it's going to be a 7-year process, and we're in here for the long haul. And that's a very different type of investor. And that's what these guys are at. They go from one table to the next with investors, and that's how they raise their money. Because look, Tempest Therapeutics, for example, who we interview on the air, okay, the single most the biggest increase in a single stock in the history of the NASDAQ, okay? Because of their top line data on phase 2, if I'm not mistaken. They will probably get acquired. However, if they don't, they're going to have to fund phase 3. That's $250 million of funding to get them for their liver cancer that looks like it's going to work.
Yeah,
exactly. Well, so they've got people that say, I'm in. I'm a player.
Right.
I'm in for $50 million. Okay. And it's a long-term play. All right, much more to come. We're going to do a little live segment here with Devon and Howie. See what they're up to.
Why am I nervous?
I know, I'm nervous too. Big Biz Show.
Welcome to the Big Biz Show, featuring insight, analysis, and a lot of stuff that's none of your business.
Hold on. This is the Big Biz Show. I think it is their business.
Making the markets work for you. Here's the man with the plan, Sully.
Show, Loft 100 Studios, wherever you are, wherever you may be watching or viewing. Thanks as always for being along for the ride. Costa, Burt Godwin, Todorov, Sully.
Would you ever be interested in going to one of these conferences just to check it out? Because it would be highly, I mean, we talked to a lot of these guys, but I think it'd be boring. It'd be like watching paint dry.
I won't understand any of it.
Howie's like, lots to see, lots to do. I'm like, what the hell?
Is it like Costco when they put out the sample food and stuff? Like
Yeah, only it's vile. How about this? You know it's no, it's not.
Almost
it's worse.
identical.
No, do you know
Tried
it's
the
like,
shot.
Do you know why it's horrible? Okay, it would be great if they had vials of it and they're like, hey, got a little something,
Yep.
right? Nothing. It's like going to Gateway Computer. We're Gateway Computer, brilliant.
Cows.
You're gonna go to the computer place.
Yeah.
You're gonna build your perfect computer. Okay, here's my money. Oh, 6 weeks.
I don't ever want to see it again.
Okay.
Ever.
I'm serious. Like, talk about just the big. Do you know how many people walked into Gateway Computers thinking they were going to walk out with a computer? Here's a place. It's like walking into the what's that crappy car you drive that all the foofy people wear? Tesla. It's like going to a Tesla dealership back in the old days where you couldn't drive. We couldn't drive one away. You could only watch it. You could only.
Yeah, you got to order it. And the whole, yeah, it's got to come.
Right.
So the bio events, it'd be super interesting. You could cure what? Here, come on. Give me some.
I can find a vein.
Mike, so they have an obesity drug that comes through a Dorito?
Now we're talking.
Like it's a bag of Wegovy Doritos.
It looks like an eclair. It really is going to help you lose weight.
Do we have the boys up? Is this on the Zoom channel, I'm assuming, up here? Are the guys there at the bio? Do we have them live?
Hey.
Look at this, Howie.
Wow.
Are you just giddy with excitement, Howie?
Well, listen, I'm gonna have to let some of these companies know that they need a Dorito delivery system for the store.
Is this it? There he is. Hey, Devin, we're liking the flow. You like the flow?
Hey guys,
You look like Doris Day.
why do you do this?
You look like Doris
With a beard.
Are you guys? Is this after 3? Well, you guys have gone through 6 days of this after going to ASCO and now this. I know you're bioed out completely, but are we seeing things there that because this is more of a, I was just describing, this is more of a dating service here, right? There's speed dating with investors.
Exactly right.
And such.
You should see the sales reps here. They're great.
Did you get a date, by the way, with that girl?
Yeah.
With the what?
It's interesting. We've spoken to a few dozen companies, and they all are saying the same thing. They're getting a year's worth of business development done just at this conference. I mean, every 30 minutes, like you said, Sully, new conversations are happening and new opportunities.
Yeah,
and
biotech investors are like buses. A lot of them comes along, like women. Another one comes along every 15 minutes. Hey, can I ask you, do any of these companies may want to be on Big Biz Show?
Ooh.
Do you get any interviews? Can we get some interviews?
Well, we may have had one or two conversations about that. You might see some new faces.
So what? So you guys watch a lot of this stuff on this show. Anything that is like, oh my God, this is going to change the world. I mean, when you look at, for example, Steve Glover and their new drug that talks about weight loss, it really does change the face of all the stuff you're seeing with the Saxenda and the Wegovy and all the other things, where it blows it out of the water. Anything you guys are able to understand? Because if I walk through there.
Well, that has been a major theme of the conference, obesity drugs, but also personalized medicine and
AI has been a huge thing we've been seeing. AI to make that personal medicine happen with gene sequencing. It's been really cool to hear about.
And Devin, AI stands for what?
Next question.
I'm trying to educate them.
So what's next? What do you guys do next? Are you chasing down more companies to interview? Any of our existing guests there that we've seen? I saw Steve Glover there. Anybody else down there?
That's right. We have Steve Glover yesterday. And
I heard James
today,
Saperstein's down there.
Yes. So in the next hour or so, we'll interview him and we'll get that clip for you next week.
You know, at the Roth Capital Conference, where they have all these small cap companies get together of all ilks, they're not just criteria specific to oil and gas or biopharma or technology. It's really a significant conference. It's here in California, and it's up in the Orange County area. It's south of LA. But every night they have like a name band. Like they had Aerosmith one year, and then the next night they had 50 Cent. And so on and so forth. Any major cocktail parties you guys are going to be going to? I should add, Devin, this question is for you because you would know. Howie wouldn't know. What's the scene like? What's the scene like there?
They have a pickleball court.
Do they have a pickleball court? Yes, they do.
Is there beer?
Is that what you're
On the top.
Are there beverages there? Is there anything fun going on there? I mean, I know you're saving lives. All right, I'd brought that. Okay, you guys are out. Can I tell you what? Can I just tell you what? Thank you guys. Good to see you. Yeah, thank you. Good to see you. Honest, no, it really is good. Can I tell you what happened? I have to tell you what happened.
Is this where you got
this is where
sand in the cactus?
This is me yesterday.
I'm tired of this. I'm sick and tired of it eating.
And then last night.
I don't ever want to see it again.
So yesterday was a wonderful day, and things happen in threes, right?
Yes.
I wake up and have a conversation with Howard, who's on his way down to BioConference.
Okay.
And of course, he comes in from New York. So whose car is he going to borrow? Is he borrowing your car?
No.
Mr. Foofy.
No, Mr. Foofy, no.
Is he borrowing your?
Foofy's. No.
Is he moving your?
He's not borrowing mine. He
72
hates
Crapmobile?
my car.
No, he's borrowing one of our cars. One of my cars, right? And the first time he had one of the people that comes on the air drive my car inside of a parking structure and doinked it for $2,800. It's like, oh, no problem. It's good. It's fine. Yesterday, I get a phone call. I go, Sully, I pulled over for a conversation on the phone so I wouldn't be distracted, but I backed into a parked car. And we'll figure it out. $20,000.
What?
Two for two. Two different cars, two times.
What did he back into?
A parked car.
Oh, jeez.
Yep.
So we have to pay for the 20 in the insurance, plus the guy doesn't want to settle. Of course, Howie's like, oh, here's our insurance, just call them. Like, no, you don't just give them my number. We'll figure it out. Anyway, so that happens, number one. And then lovely Trish, who runs $1 billion division of a $6 billion
saintly woman that she is.
Everyone loves her.
Yes.
Oh my God, honey, I left my laptop at the TSA when I left San Diego Airport Saturday. So how easy and how high speed, low drag is it to get to the TSA to find the lost and found?
Oh.
Yeah.
Is that like smooth as a gravy sandwich?
Simple, right?
You can park at the curb and run in and leave your car running.
Yeah.
You can, can't you?
Yeah.
That's it. I'm not going to say what number 3 is. Number 3, I will cuss on the air.
Okay.
So smartest guy in the room. But let's face it. I said, so do you give me your insurance? He goes, I don't have insurance. I live in New York City. That's kind of smart. He does live in New York City. He doesn't drive a car.
Right.
So silly me for letting him. I said, so I had him.
He can borrow my car next time.
No, he borrowed your Uber app, by the way. So all the Uber, so it's your Uber account is on his phone now.
Oh, okay,
so
perfect.
that's what we did.
Great.
Yeah.
$20,000?
Is there a teachable moment here at all?
Was he going 100 miles an hour and he backed up?
No.
I'm fascinated by what.
I think the teachable moment here is to teach you to stop lending out your car
Right.
to Howard. Believe me, I think.
Only took me 3 times.
What did we say there?
Only took me $23,000, but I learned.
Teach you one.
The company is Rent-A-Dent.
Listen,
for Howard.
I just, and you can't blame the kid. I mean, I pulled over so I wouldn't be distracted.
Exactly.
But
He's trying to blame this on you.
No, but I'm saying his intentions were wonderful.
Yeah.
He got off the freeway on the way down to Bion. I'm thinking, oh.
His new name is Crash, right?
It is Crash.
Yeah, it's not. You
Crash
can't.
font.
Next time, all we're
can't.
going to say is, Crash. Hey, what's up, Crash? Don't even say why. Just,
He'll know.
what's up next for you? And what he's got to come from you.
Crash.
Yeah.
What's up, Crash?
Yeah.
Because he doesn't know we're talking about this on the air.
Okay.
Anything with your kids that's happened like that you want to kill them? Have you ever wanted to kill your daughters?
Oh, God.
No, your
Jamie,
daughters
they're
are
six-
saintly.
They're teenagers.
They're
I'm a
saint.
single mom trying to deal with 2 teenagers. Are you kidding me? It's a daily grind.
We've done
How old is your boy?
Toph will be 22 in August.
Okay.
So
We got 21, 26, no, 21, 28, 29, 30, 31.
yeah. So And
the 30 is, doinked it.
if you're going to drink, obviously don't drive. The beautiful thing about Uber, blah 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 blah.
Because you're going to spill it, or is it because he's going to get an accident?
Well, even worse than that. So he and his buddies went a little hard. So he's in the Uber on the way home. In the back of the Uber.
In the Uber.
How much did that cost you?
Can I teach a couple lessons about hurling? If you're sailing, I was a racing sailor for a long time.
Sure.
So there's the leeward side where there's no wind. There's a windward side where there's wind. So if you're heeling over, right, the wind's coming from this end, right?
Yeah. Mm-hmm.
Get to the leeward side down in the aft of the so when you're it goes
Down-
that way.
downwind.
Don't go up here to the top. And go, hey, everyone's there.
What do you do in an Uber, though?
He was trying.
Roll the window down, shove your whole body out at age 22.
He was trying, and it
Is he? What is he? Is he misshapen? Is he not?
Hit the glass.
He's not athletic.
Well, if you're at the
I've seen you in athletic moves trying to hurl out a window after a bad meal.
I know.
And you were sober as a judge.
So that's like, that's what is a normal.
So my question is, what's the
$30 Uber drive is now like $270.
My question though is what is
you're happy because they didn't.
Right, but what is the punishment though, for stupidity? You can't teach stupid.
No, you can't.
Is there?
Punish? I don't think you can punish it.
Oh, I can. I'm gonna.
No, I just said, hey, you're going to.
Because chances are.
It's best served cold, Greg. This type of revenge is best served cold.
Well, chances are he's not feeling too good about it.
That's part of
it. So do you rub his nose in it?
He's like, hey, let's go to dinner. He goes, okay.
Right.
I'm like, don't worry, we'll get sorted out, dude. And of course, I fling him over how much it costs. Oh. There you go. So
20,000.
You got to be careful. He goes, can we like negotiate this? Yeah. I can either kick a finger or you somehow put on your insurance and lie. Those are your two options. Big Biz Show.
It is the Big Biz Show, live from the Loft 100 studios here in sunny Southern California. In over 175 countries, all this just to see on the American Forces Network. To our brave men and women of the United States Armed Forces, as always, thank you for what you do for us. Costa, Mary Bird Godwin, Greg Todorov, Sully.
Mike Costa.
Yes, sir.
Don't call me sir, just call me Admiral. We've talked about this before.
But I call my father-in-law, by the way.
Have you ever been to Europe?
Yes.
You have. Where'd you go?
We've been Italy, France, England, Spain.
Have you been to Scotland?
I've been to Scotland as well.
Have you?
Way north up by the friggin'
Did you talk like this?
Oh my God.
Did you unite the clans?
What?
Did you unite us? Unite the clans. Did you unite us?
Better to die on your feet than live on your knees. Yes, I have.
Of course.
Everyone goes right to Braveheart.
Mary said, I thought my brothers were moved to Minneapolis and Nova Scotia. The reason I bring it up is, of course, Bryan Kobel.
Is that where he is?
Is Kobel.
Yes.
By the way, Greg, is it Kobel or is it Kobel?
I think it's Kobel. I keep telling you.
No,
Kobel.
you keep telling us
I've told you that from day one. It's Kobel.
I thought it was Kobel.
Brian, how is I could do a mic thing right. I should do a mic thing here, shouldn't I? How is lovely old Scotland? I should do a Dumb and Dumber like Mike Costa would do. Oh my gosh. How's the Blarney Stone there in Scotland? Oh my God.
Good day, mate.
Hey, great to have you.
Put another shrimp on the ball before us, Brian.
Oh my God.
Brian, I'm sorry.
I know. The reason I was talking about it is because Brian and I are meeting up there later in the month to talk to investors and such like that. So I was just saying, have you been there? Because you seem like a guy that would have been there.
Oh, I love Scotland.
Do you?
Yeah, Scotland.
But did you talk like that? Because Brian, when you're there, they stop you and say, "Oh, you have an accent," and you're just a guy.
They do. Well, I think that's what they're saying. I don't really understand them. 90%.
I can't really understand this. I know, because sometimes you talk to a Scottish guy.
Forget it.
It's thick. It's thick.
Yeah.
It's thick as molasses. What do you see when you look out of a hole, Michael? Molasses. Thank you. I'm sorry, Brian. We're going to go over for you today. Hey, listen, last time we were on the phone and on Zoom, you talked about TCB 008 as the lead product for the therapeutic in multiple diseases, but we didn't get to the multiple diseases. And we talked last time about how we're going to talk about this. This is a panacea. Talk about this a little bit, because it really is sort of a panacea. I know you can't say it as a CEO, but I can say it because I'm just a pundit. So tell us about that. I think that's important, because this is we're not just focusing on one malady here.
No, it's the first kicker, obviously, is blood tumors or acute myeloid leukemia. We're moving now rapidly into antifungal. So aspergillus and candida. Aspergillus is something you get, usually when you're immune suppressed or immune compromised. We're looking at solid tumors. We have an autoimmune angle as well. So, the gamma delta is really an incredible cell, and it's so ubiquitous as it pertains to fighting diseases that we're just looking to leverage that as much as we can.
Bryan, the rest of 2025, you anticipating some big inflection points?
Yeah, we have a bunch. So we've shipped some products. We expect to dose our first patient in the second quarter of our phase 2B in acute myeloid leukemia. So we should see a data readout probably before the end of the year, showing what we expect to be safety and efficacy again, which we saw in our phase 1B as well. We also expect to close at least 2 acquisitions in the next 90 days, let's call it.
Sure.
Additionally, we're pretty close, I think, to finalizing a collaboration here in conjunction with another company in the cell therapy space. Again, this use of the gamma deltas, it's not an immune cell, it's an immune system, right? So we're excited about what we're seeing. NK cells and gamma delta cells work really well together. You've seen a lot of great activity in the CAR NK world lately. We believe the gamma deltas will leverage into that. There are a lot of companies that are trying to turn cold tumors hot to gamma deltas and draw them in because they orchestrate immune responses. So they bring in other immune cells to the sites of tumors. So, we're looking at a lot of those opportunities, and we think we're pretty close to getting one sorted here and moving forward in another oncology indication.
Bryan Kobel, the CEO of TC Biopharma Holdings, NASDAQ TCBP, with us here on the Big Biz Show.
I got a question, Bryan, and this is like, when you go to buy a new car, all you can see is the car you intend on buying on the road. Everywhere you go, it's now like everyone has one. Why am I hearing about allogenic gamma delta suddenly? Is this because you've been talking about it, and I know that of course Siri is listening to my phone, but honestly, if you look at the news cycle, it's actually something that is front and center in biopharma and biotech. Is there a reason why that is? There's more biopharma research being done, or is it just being brought to light because of the problem it causes, the problem itself?
I think it's a combination. Yeah, no, it's a combination. It's a combination of things, right? You are right. There's more sort of research going on and coming out. But I think a lot of it is, if you look at the issues with cell therapy and some of the major hurdles that need to be cleared before you can really be, a standard of care, commercial, economically viable product, the allogeneic gamma delta cell does a lot of that. One, you can mass manufacture it in commercial grade, commercial scale, because you donor cells to grow them up. They're really active. They're highly toxic in the system relative to the cancer, but they're also extremely safe to the patient. So you can put hundreds of millions, billions of these cells in and don't see a cytokine storm. You don't see any sort of side effects. Maybe a little bit of a tummy ache for about 3 minutes, but no big deal. Obviously,
watch this show when Mike opens the segment.
Yeah. So it's one of those cells that, if you're trying to create an immune response, it's an immune responder, and it tends to orchestrate immune responses. It tends to be the conductor. If you think about it, since we're in Scotland, you were talking about Braveheart, the gamma deltas are like the Scots, right? They're sort of this smaller population of the cells. And they're fighting the British, which are, cancer, and they run to the middle and they meet the Irish, which are the other immune responders.
Crazy.
And they go, okay, let's go kill the British.
But
right?
they're there.
Gamma deltas are doing.
Right. What interesting here is that this positions you sort of as a small biopharma as a leader in this suddenly, because it's not that you're a little train that could, but between the acquisitions that are being announced and between the allogenic gamma deltas that you're kind of leading the league on, suddenly this makes you guys sort of front and center. How are you dealing with all with the notoriety and the phone calls? Because I got to believe when you go to LD Micro, or you go to Biocom, or you go to ASCO or any of these other ones, you're going to get pinned. You're going to get cornered.
Yeah, I'm excited. Actually, I'll be in Boston next week. I'm speaking at a conference. I think it's the 6th Gamma Delta Summit or something like that. And when we get a lot of notoriety and a lot of questions about what we're doing and how can we work together and things like that. I think what's really exciting is, to your point, this is going to be one of those stories where, investors don't really pay attention. And then all of a sudden, in 12 months, when cell therapy's back and we're a CAR NK, CAR gamma, everything, they're going to go, oh, we were here all along. We loved you guys.
Right. Well, don't be surprised if you see don't be surprised if you see Howie Font, our lead analyst, and our cameraman there next week, taking a picture of you over there, because we may be falling out of the camera more than we always.
I sign autographs.
There you go. Bryan Kobel, TCBP. course, TCBP is their stock symbol, but TC Biopharma is their name. Biopharma, I should say. TCBP, there you go. Thanks, Bryan. All right, coming up next, Dr. Jonathan Javitt. We're going to talk about a thing called akathisia.
Loft 100 Studios, the Big Biz Show, and our affiliates and our hosts are not registered investment advisors or broker-dealers.
Our show hosts make no commitment that the purchase of securities of companies profiled or otherwise mentioned in our programming
are suitable or advisable for any person, or that an investment in such securities will be profitable in general.
Given the nature of the company's profile and the lack of an active trading market for the securities, investing is highly speculative and carries a certain high degree of risk.
We profile selected publicly traded and privately held companies on our program.
Most of these companies that we profile have provided compensation to Loft 100 Studios and its hosts for the profile coverage.
From time to time, we sell shares of the companies profiled in the open market that we receive as compensation for coverage of client companies.
But never sell stocks if we are speaking about interviewing or covering a public company who has paid compensation.
Specific questions on compensation can be obtained by contacting producer@sullygroup.com.
Listeners should verify all claims and do their own due diligence before investing in any securities mentioned on this program.
Investing in securities is speculative and carries a high degree of risk.
We encourage our investors to invest carefully and read the investor information available at the websites on the
Securities and Exchange Commission at sec.gov and or the Financial Industry Regulatory Authority, FINRA, at www.finra.org.
I like it.
I'm tired of this. I'm sick and tired of an 8 and 10.
Not kidding.
Big Biz Show. Wherever you are, however you are watching or listening, we always thank you for being along for the ride. Mike Costa and my beautiful goldenrod. Mary Bird Godwin, Greg Todoroff.
Is she your beautiful goldenrod?
No, I thought you were talking about me for a
No,
minute. I was like,
in
hey.
my beautiful goldenrod.
Oh, that's
summertime.
right.
Yeah. Mary Bird Godwin.
Did you get that off the
Greg
back of Parade magazine? It's a jumper. You just see the shorts that comes with it.
Oh,
Big Biz Show. One person that calms me down is one of my favorite people in the world, and he challenges me all the time. He also is a friend of mine, and of course we feature him in the program all the time. Dr. Jonathan Javitt. He's the founder, director, chairman of the board of NRX Pharmaceuticals, stock symbol NRXP. And he called me 2 days ago and he says, we got to get on the phone. This is on Sunday or Saturday or something. He says, we got to get on the phone on a Zoom call. I need you. He goes, I need you not to be distracted. I go, what are you talking about? Me?
Me?
Should bring him up. I want to see the look at his face when I say this. And I said, okay. So yesterday morning at the butt crack of dawn, we got on the phone and he talked about what we reported last week. And we talked about it on the air. There was a couple bullet points on his top line research. Unbelievable stuff. But he said, I got to tell you, we need to focus on this thing because it's called akathisia. And he's going to talk about this. Talk about an eventful week. It's a crazy eventful week. So I'm going to bring him on. We're going to go right into it. Dr. Javitt, great to see you. Thanks for putting up with us once again. But let's talk about what you and I talked about yesterday, because this is really, really important stuff regarding this thing called akathisia and suicidality, because this kind of is a game changer with respect to everything we've been talking about thus far.
So, it's a word with too many syllables that a lot of people haven't heard before, but it is the worst thing that can happen to you if you're taking an antidepressant drug. This is the reason why antidepressant drugs cause suicide. And that's not an accusation or a theory. It's right there on the label of every single antidepressant drug. The FDA makes the manufacturer say, this drug can cause akathisia. Now, what is akathisia? I gave you guys a website that they're going to put up because the story's told much better by Wendy Dolan, whose husband killed himself. And because of the tragedy she faced, and because she actually won a very large settlement from the manufacturer of the antidepressant that caused the akathisia, she started a foundation to teach people about what this condition is. But basically, it's the inability to stay still, to forces you to pace around the room, to be agitated, to feel like you're jumping out of your skin, and all too often, the next jump you take is out the window or over the railing. Since we started this company, we've lost the son of a board member. We've lost one of our founding investors. This is an absolutely lethal side effect, and yet it's not talked about because until last week, there really wasn't anything to do about it other than warn patients. So I thought I'd bring you a picture, just to show you what we reported last week, where we showed that with our drug, akathisia in people with suicidal depression goes way down. On the standard of care drug, it goes way back up. And you don't need statistics to see that these two curves are very different from one another. And not only did we see a difference in akathisia, we saw a marked difference, and this is the second trial in which we've seen it. We saw a difference in recovery from suicidality in people who were suicidally depressed at the start of the clinical trial. Now, this is actually the first time that a drug manufacturer has let people with active suicidality into a clinical trial. Usually they're excluded. And that's why we came along and said, no, let's develop a drug for the people who are at greatest risk.
So as you can see here, the graphic here, and we'll explain it. I can't spell akathisia, and I want to, I think I know why it matters from what you just said. Akathisia is the thing that causes you to say, I'm going to jump off the cliff, correct? I mean,
akathisia is the thing that gives you the momentum to do it.
Okay, so, there's a graphic that we're going to show here in just a second here that shows that with other antidepressants, this akathisia incident goes up, and you have an inverse relationship to this. It's almost like bonds and interest rates. With your drug, it goes the opposite direction. I'm referring to the slide that we looked at yesterday that you folks will be able to see here in just a second. So talk about that piece of it for a minute, Jonathan.
So that's what we showed. And this is really a discovery that Dan Javitt, my brother, made back in 2009 from a small pilot study where he showed that when you combine the standard antidepressants with drugs that target a different receptor in the brain, something called the NMDA receptor, that NMDA receptor drug blocks the akathisia that's otherwise caused by every known antidepressant. And this has never been shown before. So in 2009, he proved it in animals. 2018, we showed the first results in patients, and the FDA gave us something called breakthrough therapy designation because they viewed this as important information about a life-saving drug. And then we had this small thing that you may have heard about called the COVID pandemic, kind of shut down our clinical research for 3 years. So we were only able to get the research restarted in 2013, and here we are with statistically significant data.
Dr. Javitt, how come we haven't heard about it before? Is it been covered up? Is it being hidden from us? Or is it just something that has been stumbled upon?
Well, you have heard about it before if you read the label on every single antidepressant known to man.
Okay.
And the pharmaceutical companies have heard about it because they've lost huge class action suits that have cost them hundreds of millions of dollars. And that's why all of the pharmaceutical companies got out of the antidepressant drug business. Because this complication's always been known. It's right there on the label. Good doctors warn their patients about it. But even so, it happens in 15% of people. And that's why so many people who are taking antidepressant drugs kill themselves.
Dr. Jonathan Javitt with us again, founder, director, chief scientific officer.
Chairman of the board now.
Chairman of the board.
Come on, don't mess it.
Sorry, NRX Pharmaceuticals, stock symbol NRXP.
Dr. Javitt, it's great to see you again. And can you tell us what is next for NRXP?
Well, now that we've shown this, the next thing to do is get the drug approved. So we're going to be meeting with FDA, and what we need to show next is a large or two slightly less large clinical trials proving once and for all that this drug is better than placebo. And at that point, hopefully it will be doctors' first choice drug for bipolar depression, because if you've got a choice between a drug that has a 15% chance of causing a lethal side effect or potentially lethal side effect, and a drug that's shown not to cause that side effect, that might cause you to prescribe the drug that's less likely to cause the side effect.
His name is Jonathan Javitt. Of course, he is the man over at NRX Pharmaceuticals. By the way, Dr. Javitt, we were able to contact Wendy Dolan, who is, of course, her husband is the impetus for the website we saw in the beginning, whose husband committed suicide as a result of akathisia. And we're going to have both Jonathan and Wendy Dolan on here. Not into next week, into the following week. And Jonathan is the one who pointed out to us. Thank you for that, and hopefully we'll shed some light on that for you guys. And also, this is earth-shattering. This changes everything in terms of the research and in terms of the top-line data that they have. Well, now we have data, and sky's the limit for these guys. Jonathan Javitt, of course, NRX Pharmaceuticals. NRXP, more big biz coming up.
Thank you, guys.
Sunny, sometimes gray, Southern California. June gloom, man. It is June gloom. We're dealing with it though. Wherever you are, we hope you're dealing with it, whatever you're dealing with. As the Big Biz Show rolls on, Costa Berry, Godwin, Greg Todorov, and our man Sully.
Better June gloom than pasty July, Mike.
I'm pasty all year round.
I saw a photo of you guys on a cruise ship or some vacation thing.
My sister's boat.
Oh, it was. Oh, it was a boat.
The boat.
Ram Makunda is the founder and chief executive officer of a company called IGC Pharma. Their stock symbol IGC. We're happy to have him back on there, and I think we're going to have him on a regular basis coming up. They're the only THC-based treatment under investigation in FDA trials for Alzheimer's disease. And it really, their phase 2B trial for agitation in dementia, and that's sort of what we're seeing here, is really obviously for me personally very, very interesting. But last time he was on the air, we got close to 30 emails asking about what their company was. So I bring him back to you. Ram, great to see you, sir.
Hey, very good seeing you again, and thank you for having me on the show again.
Anytime. Can you break it down what I just talked about, agitation in Alzheimer's disease? Because this is something that is probably the most heartbreaking piece of this disease, at least for loved ones, correct?
Yes, it is. And so it's interesting what you said about your mom. About 400 million people around the world suffer from prodromal Alzheimer's, which is changes in the brain and mild cognitive decline or impairment. So that number is very, very big, 400 million.
Yeah.
50 million people around the world have Alzheimer's. So these numbers are very large. About 70 to 76% suffer from agitation. And agitation is, last time I was on the show, I think we talked about this. Agitation is not road rage. It's not someone just got angry, someone got agitated. This is a medical condition that impacts and affects people with Alzheimer's. It's things like physical aggression, verbal aggression. It could be pacing up and down. It could be throwing things, disrobing. All of those are all considered signs or symptoms of a syndrome called agitation.
So I got a question about this agitation, because from where I'm sitting, it's like a 3-year-old who is frustrated. All the things you're describing feel like someone who is frustrated. Is there a connection there, or is that just how it's manifesting itself? Because maybe they're frustrated because they can't communicate, because they can't remember, because they realize they're repeating things, or maybe they just don't. This is just an outside symptom. Because if the things you're describing are absolutely spot on, I can tell you. But at the same time, it seems like she's just pissed. She's just frustrated because she can't take the next step.
Sure. Excellent point. The difference is that in an individual that's agitated momentarily, they get over it. Whereas here, this is part of the disease. It's caused by neuroinflammation in the brain. It's caused by neurotransmitter imbalance. So you really have to get to the root of the problem, which is neuroinflammation. which is what our medication does. It addresses neuroinflammation. It's also a CB1 receptor partial agonist. It restores the imbalance in neurotransmitters. So it's a syndrome, right? So it's part of the disease. So it's not symptomological agitation, which is you got agitated because something happened. That's not what this is. This is part of the disease. And this also is very devastating on families because it causes it's very difficult for caregivers to take care of patients.
Yeah, because you don't want to be around her. I mean, and that's the thing. And you know, for me, I had hopes. Oh my God, I hope she's frustrated because that means she's cognizant of this happening. Yeah. It feels that's not what it is.
Ram Makunda with us. He's the founder and chief executive officer of IGC Pharma. Sticker symbol is IGC. Ram, IGC 81, in a nutshell, how does it work?
Great question. And so I have some very good news that I want to tell you guys about. IGC 81 is a combination therapy. One of the active pharmaceutical ingredients is THC, but it's a very, very low microdose of THC. It's not high enough. It's not large enough to make a person or the individual high. It doesn't have any of those symptoms. It doesn't make you high. There's no euphoria. All it does is it reduces neuroinflammation. So that's one of the two active ingredients in IGC 81. We took this to a phase 1 trial, and what we saw was that we saw signs where neuropsychiatric symptoms like agitation, anxiety, depression, irritability, which are all associated with Alzheimer's, were all reduced. So we took it to a phase 2 trial, a much larger trial, 146 patients, and we have some interim results from our first group of patients. And these interim results are very exciting. They show that agitation is reduced in as little as 2 weeks. Well, that's the measure. The first measurement was 2 weeks. The second measurement was 6 weeks. So in the first 2 weeks, we saw a dramatic change or decrease in agitation. That is very different from the current medication that's out there. It's an atypical antipsychotic, which takes about 4 to 6 weeks of titration, meaning that you don't get the effect for 12 weeks, 10 to 12 weeks. Whereas here we have a medication that can act within 2 weeks. And as you know, the Sully from, even your mom, if she's agitated, you want to be able to give her medication that acts fairly quickly. Yeah. Not something that acts over 12 weeks.
That's what I was going to ask you. Is it something that you take when you see them being agitated, or it's something like, it sounds like you start it and it's something you take every day to kind of fend it off for the long term?
Yes, every day. That you're absolutely right. It's not like taking aspirin. You've got a pain, you take some aspirin, it goes away. This is neuroinflammation, you're trying to bring it down. So this is something that you would take, but the effect that you see is very quick. Go ahead.
Well, what's interesting is, if it seems like you could use this in other indications. I mean, isn't that the natural thing? It seems like it crosses over to a number of things.
It does.
Like sleep disorders.
We believe it does. Yeah, exactly. We did see an improvement in sleep with the patients. So we're looking at depression, we're looking at sleep, we're looking at all of the many other. Anxiety is a big one that we're looking at. But Sully, you're absolutely right. One of the trials that we're thinking about is PTSD. Yeah. We think it can really help with PTSD.
Wow.
Ram, we need to get you in studio. This is one of those hour-long conversations.
I want to come to your studio.
You got to come in. Listen, you see a lot more of Ram Makunda, IGC, of course, IGC Pharma. I have to say, when it starts, and my mom they have not diagnosed it, but man, everyththing's right there.
Yeah. Really? Does she have sundowners?
No.
Okay.
But she have a Sundowners Club they drink a lot of scotch at. It's every Thursday at 3:30 p.m. before
dinner. That's
dinner.
a good type of sundowner.
Breakfast at 4, lunch at 11, dinner at 2:30, sundowner 3:30. Used to be called happy hour. Happy hour is now called, what's what we're looking for? Oh yeah, bedtime.